Did you know that there is a dangerous and very common virus that causes several deadly types of cancer, and that almost everyone who is sexually active will contract this virus at some point in their lives? Did you know that every 2 minutes, someone in the world loses their life due to complications from this virus, and that these complications are completely preventable? I'm Dr. Etemadi, and in this video, I'm going to talk about the HPV virus and genital warts. I'll be discussing the cause of genital warts, as well as methods of prevention and treatment. That's what I'll be talking about in this video. So if you want to have more up-to-date information on this topic, make sure to watch this video until the end. Also, if this is your first time visiting my channel, please subscribe and don't forget to like the video. If you have any questions about this video or my previous videos, be sure to write them for me in the comments. All right, let's go and learn more about genital warts and the HPV virus. First, let's see what HPV actually is. HPV, or Human Papillomavirus, is actually a family of viruses that includes about 200 different types. Most of them are related to skin lesions and cause the same warts that appear on our hands and feet. But around 30 to 40 of them affect our genital and reproductive systems, and it's this group of viruses that I'm going to talk about in this video. They are transmitted very easily. Almost everyone who is sexually active is likely to have contracted this virus at some point in their life. And the important thing is that sometimes it shows no symptoms, but it can still be transmitted even when there are no symptoms. Unlike other viruses that cause sexually transmitted problems such as hepatitis B and C viruses, which are transmitted through blood and bodily fluids, this virus is transmitted through skin-to-skin contact, and this skin contact can lead to the transmission of the virus. It can be present in the vaginal area, the male genital area, or even the anal area. And even if you have oral sex, it can affect the throat area and cause problems in that region. An important point you must pay attention to is that preventive methods like using condoms can reduce the risk of transmission to some extent, but they are not 100% effective in preventing the spread of this virus. And also, people who engage in high-risk sexual behaviors or have multiple sexual partners, the likelihood of contracting this virus is much higher in these individuals compared to the general population. However, it is also possible for the virus to be transmitted from mother to baby, or even if you use public places like swimming pools or use someone else's personal items, for example, using another person's towel. But of course, the probability is low. The highest probability is through direct contact that occurs between two people. The next important issue that I definitely need to mention is the complications of the HPV virus. If our immune system is functioning properly, in 90% of cases, our own body can control the virus, but it does take time. It might take a year or two. And the point is, as long as the virus is present in our body, there is a possibility of transmitting the virus to another person. That means we may not have any symptoms, but in reality, we are carriers. In the remaining 10%, the virus stays in the body and causes complications. The most important complication caused by this virus is genital warts. Warts are actually fleshy bumps that appear in the genital area or around the genital region. These bumps I mentioned can appear individually or in clusters, sometimes resembling cauliflower. They are not precancerous, but they can be bothersome. They can cause itching. They are irritating, and I will explain to you how we can treat this condition. On the other hand, high-risk types of HPV can infect the cervix in women, cause precancerous lesions, and ultimately may lead to cervical cancer. This type of cancer is the fourth most common cancer among women. Therefore, it is very important for women to include regular screening in their healthcare routine. HPV can also cause cancer in the anal area. It can affect the male genital area, and as I mentioned earlier, it can even cause cancer in the throat area. So here a question arises. If we have been infected with the HPV virus, what can we do to prevent complications from developing? The good news is that in most cases, the body itself is able to suppress the virus and no special treatment is needed. And the not so good news is that if the virus remains in our body, currently there is no antiviral medication that can absolutely and completely eliminate the virus. However, the complications caused by the virus are treatable. For example, if you develop genital warts, you can use topical solutions and medications that actually burn off the lesion. For example, you can use podophyllin ointment or Metomed solution. You can also use cryotherapy, which burns the lesion with liquid nitrogen, or you can cauterize it and remove the lesion with heat. Or you can remove the lesion with a laser. But the important point is that there is a possibility of the lesion recurring. Since the virus is present in the body, it is possible for it to recur again. In the case of complications and precancerous lesions, If, for example, through tests like a pap smear, it is determined that you have that precancerous lesion, you can still remove it with a laser or cryotherapy. But if the lesion develops cancerous problems, things get a bit more complicated. In the early stages, it might just be monitored, but if it becomes more severe, it may be necessary to remove the lesion or even to remove the lymph nodes or a large portion of the tissue, or even to undergo chemotherapy or radiotherapy in order to control the condition. That's why it's so important for you to undergo screening and to be regularly monitored by a doctor. The next important issue is prevention. Prevention of contracting and being infected by this virus needs to be addressed on several levels. In my opinion, the most important aspect is education. Children, especially those who are at an age where they may engage in sexual activity, need to be educated. They should be told what this virus actually is, how it is transmitted, what they need to do to avoid transmission, and this education should take place both at school and within the family. Alongside that, there is the issue of sexual hygiene. What I mean is that a person who is in a situation where they can have sexual relations should avoid risky sexual behavior, not have multiple sexual partners, and most importantly, should be regularly monitored and screened. It is recommended that women over the age of 21 get a pap smear test at least once every 3 years, though ideally once a year, to check whether any precancerous lesions have developed. And the best method of prevention is the use of vaccines. Various vaccines have been developed, each of which can actually prevent infection by certain specific strains of the virus. The best type currently available on the market is the Gardasil vaccine, which protects against 9 dangerous types of the HPV virus. It is recommended that these vaccines be administered to children between the ages of 9 and 15 before they become sexually active, although even if given at an older age, they are still effective. Previously, it was necessary to administer this vaccine 3 times, but according to a recent protocol, it has been shown that even a single dose is effective. Unfortunately, in our country, this vaccine is still not provided for free, and those who want to use it have to pay for it themselves. The cost of the vaccine, to be honest, is not low either. It might put some financial pressure on people, but I hope that in the future, the Ministry of Health will take measures so that people can access this vaccine and other vaccines of similar quality for free. Well, in this video, I tried to simply talk about the HPV virus, its complications, and ways to prevent the problems caused by the HPV virus. If you found the information in this video useful, I kindly ask you to share this video with your friends, and if you have any questions, please write them for me in the comments. Until the next video, stay healthy and well, and I hope only the best happens for you.